One of the most controversial issues relating to the medical field is the free choice of being able to end your life using lethal medication. Physician assisted suicide is a practice in which a physician provides a terminally ill patient with a lethal dose of medication upon the patient's request, which the patient intends to use to end his or her own life. Unfortunately, death is inevitable, and in many cases, physicians want to help limit the discomfort an individual feels. In the United States, there are currently 6 states: Oregon, Colorado, Vermont, Washington, California. Certain individuals in Montana and DC have legalized physician assisted suicide. A terminally ill patient can best be described as a patient who cannot be cured and has less than 6 months to live. The medicine prescribed to terminally ill patients are supposed to help alleviate the pain an individual feels. However, many times they will still continue to feel discomfort. For many years, humans have had to deal with pain and suffering that come along with diseases such as cancer or heart failure, and today's medicine has helped significantly prolong patients' lives. But the treatments may not be the best for terminally ill patients. If they have the right to prolong their lives, why should there be restrictions on ending terminally ill patients' lives, when in most cases the treatment causes them to be in constant pain? On the other side of the controversy, the people that are against physician-assisted suicide believe that terminally ill patients should not be able to end their lives. They firmly believe that it is against the Hippocratic oath doctors take to end a patient's life, and it will lead to a slippery slope, which can almost be seen as murder. The two major ethical dilemmas associated with physician-assisted suicide are patient autonomy and the quality of life. Patient autonomy is when a patient is able to freely make a choice about their medical care without the influence of a physician. Physicians are careful to solely inform their patients on the basics of physician-assisted suicide. In order to honor a patient's autonomy, it is important that the patient is informed about the decision and consequences that come along with physician-assisted suicide. In order to be eligible to go through physician-assisted suicide, you must be 18 years old or older, a resident of that state, capable of making and communicating health care decisions for him or herself, and terminally ill. Another important dilemma is quality of life. It is important to enjoy your quality of life rather than quantity, even when you are suffering. In fact, many terminally ill patients may refuse treatment and medication because they want to live their last few months enjoying what makes them happy. For example, my mom was terminally ill, and in her last few days, she wanted to go back to Sierra Leone, where we were all born, back to her homeland, and just enjoy her death there. And in a hospital, she was being kept comfortable because there's nothing further they can do to save her. So a decision that we made was to send her back so she can just be back in her homeland. Many argue that the patient should not have to suffer when he or she is in the last few days of their life. If a patient has terminally ill diseases like AIDS, cancer, heart disease, they will need to have a lot of painful treatments, such as chemotherapy, which in many times will result in hair loss, leave you feeling weak and lethargic. Throughout the course of chemotherapy, it doesn't really help them get better. In many cases, the patient will feel weak and may not be able to undergo certain procedures due to their bad health. Physician-assisted suicide in a family's perspective is going to be controversial. No one wants to lose their loved ones, but on another hand, nobody wants to see their loved ones in pain. The family will often hear out the different options, but if they decide to go through with physician-assisted suicide, there are multiple steps and actions you must take before you are able to be approved. According to the American Medical Association, AMA, physician-assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means and or information to enable the patient to perform the life-ending act. The physician provides sleeping pills and information about the lethal dose while aware that the patient may commit suicide. During this time, it is tragic for not only the patient themselves, but the family. And the doctor is really caught in a crossfire where they have to follow this code of medical ethics and just basically go against everything that they are taught. They are meant to be healers and savers, and when they are doing these type of things like physician assisted suicide, it's contradicting their nature. So it's not only hard on the patient and the family, but the doctor to see the patient going through this and the patient not wanting to go through any of the pain anymore, because physician assisted suicide is meant for patients who are terminally ill that have no way to cure themselves. There's no cure found just yet, like cancer that affects a lot of people in the United States, and it hits home to a lot of people. Also, when they're engaging this assisted suicide, they follow basically basic steps of conduct and moral to just make sure the transition is smooth for the patient and the family. So one of them is should not abandon a patient once they are determined that the cure is impossible. They don't abandon the patient. They keep the patient feeling good, because at this time the patient is well aware and the decision that they're making is very hard on them. So they need all the support possible. The second one is must respect patients' autonomy. The third one is must provide good communication and emotional support. So one thing that the doctors are required to do is tell them every process step, just the whole context of what they're getting into, how it will affect them, how it will feel, the dosage, and every piece of information they are required to tell the patient so they know what they're getting themselves into exactly, and be there for them through this very tough time. And the last one is must provide appropriate comfort, care, and adequate pain control. They must make sure that the patient is comfortable and they're taking care of the patient just as they would take care of a patient that wasn't terminally ill. For my mother, they made her comfortable. At the time, I didn't really understand what was happening. So one of the nurses just basically explained to me that they're making her comfortable because there was nothing more they can do for her. And I appreciated that, because even though I knew she wasn't going to live very much longer, you still treat them as if they are healthy. You still treat them fair as you would treat any other patient. And that's what really has made me want to go into the medical field also. So physician assisted suicide is something that is tough on not only the family, but the doctor, everyone involved in the process. And it's something that no one would ever want to come to, but I feel like it's appropriate because nobody really knows what the patient's going through but the patient. Living a life of pain is something that no one can imagine going through. So I feel like people have the right of choice and what's best for them. And the physicians are trained and have really worked their lives for this moment, and they're always there for the best interest of the patient. So I agree with physician assisted suicide when it comes to cases like terminally ill and painful diseases or viruses that don't have a cure.